Good morning.
Good morning.
Good morning.
It is a Sunday, beautiful Sunday morning, but as usual, we're in the hospital. What a difference. I just wanted to kind of like get together. Obviously, you just been to the Dr Remzi, and this is your day 4
For post-op,
Yeah,
Wednesday, Thursday, Friday, Saturday, Sunday, 5.
day 5, and day 5 checkup. And are you happy with everything? Mutlu musunuz her şeyle?
Tamam.
Yeah.
Güzel, sonucumuz bayağı
Okay.
güzel. Bekliyoruz.
What did you think? Obviously, day 5, and you had your dressings changed. Are you happy with
Yeah.
the results?
I'm absolutely ecstatic.
You're ecstatic. Okay. I just wanted to basically just take this time and have a little bit of a chat about the process. How you arrived, and how annoyed you were with me, and then. And then you actually, I said, wait till you see Dr. Remzi, wait until you see Dr. Remzi. And then obviously, and what you two decided to do in the end, and then what happened?
Dr. Remzi won the negotiations.
Yes. Dr. Remzi won the negotiations,
Yeah.
always. Şeyden bahsettim hocam, yola çıktığımızdan beri, bu Sleeve Journal'sine başladığımızdan beri hep bu plastiği tartışıyoruz. Hani ne zaman olacak, kaç tane ameliyat olacak. Pam ayrıca bizim çalışanımız olduğu için ayrıca bu şeyi de biliyor, süreci biliyor ama hep sürekli hani bize söylüyor ya, şey yapabilir mi? Breast lift and implant, tummy tuck, thigh lift, arm lift, hepsini aynı anda yapalım diyor ya, kendisine de aynısını olmasını istemişti. Ben de dedim ki hayır, ben bunlar için fiyat vermiyorum sana. Gel, doktor ile konuş, ondan sonra o ne derse ikimiz karar verin neyi yaptıracağımızı demiştik. So, what did you want doing?
I wanted a breast lift and reduction, I wanted my thigh lift, and I wanted the tummy tuck, and as much liposuction as Dr. Remzi would do. And I just thought it would be very easy to do. I thought it would be, yep, we'll get it done. And obviously Dr. Remzi had spoke to me when we were doing our consultation and explained how difficult it is on the body to recover from those surgeries. But being me, I was kind of like, no, I'll be fine, I've had 3 kids, so do this, no problem. But after that wee bit of negotiation, we obviously bowed to Dr. Remzi's experience, obviously, and I had the 2 surgeries, so I chose to have, he asked me to choose, so I chose breast lift and reduction and thigh lift, and I got some liposuction around the bra line, and I'm very fortunate enough that we did listen to Dr. Remzi, and he wasn't a surgeon that was going to do what I asked him to do, because recovering from it, although I would do it again and I'm coming back again to get the rest done, it's not as easy as you think it's going to be. It's an extremely difficult recovery to get yourself there and feeling good.
Obviously, I was always trying to explain this to you on the phone when you ask either for yourself or for other people. I mean, for Dr. Remzi, biz niye hocam önce onu bir açıklayalım. Niye biz bu kadar ameliyatı aynı anda yapmak istemiyoruz?
Yani hastayı riske sokmamak için hem daha başarılı bir ameliyat sonucu alabiliyoruz ameliyatlarla. Emboli açısından hastanın uzun süreli ameliyatlar hem risk hem de yara iyileşmesini de etkiliyor. Onların bir sorunu oluyor.
What basically Dr. Remzi basically forced is your safety. The operation is an elective surgery, so we have to make sure it is safe for you and for him at the same time, because you are under the anesthetic a long time. To have just 2 surgeries, never mind the 3rd surgery. And if you are actually having the 3 surgeries, you have to actually do it quickly. And so your anesthetic time is basically less. And if you're doing it quickly, so you're not being as precise as as good as basically your results, and everybody who's been through it. We all seen his work now, so we know what he's like. He is absolute perfection.
I mean, he stood there for nearly 2 hours while he drew how he wanted it, how he envisioned it to look, and it's just even better than I could possibly have thought it was going to be.
Yeah, so basically we only pick and choose, there was only so much tissue that he can remove, so much fat he can remove from a body without putting you at risk. So that's why you had to choose between, and it's also, it says if you stress the body so much, it's affecting your healing process, it's
Mhm.
affecting your scars as well,
Mhm.
and how you're going to scar afterwards. Yeah, so for the better results, you only got your 2 surgeries, your breast lift and reduction, and your thigh
Nice.
lift, and a bit of liposuction as well.
Mhm.
So yours was good, and your sister's was,
Amazing.
you know,
It's amazing as well. I mean, Ali's just not like me. She'll not come and do the
no,
interview things, but she looks incredible. Dr Remzi had Ali sitting there earlier, and me as well, and he was showing us our before and after pictures of what he had took. We've took pictures. We took very precise pictures. So when Ali was there, I was over there giving her a bit of privacy, but obviously we're sisters, so she's like, come and see this, and it's just incredible when you get to see them, it's just absolutely
you
incredible.
wait till 6 months after this. So
I get quite emotional about it because we've waited a long time. We've done a slave journey first, and then we've done all this, and we've had all the travel chaos that everybody's had to put up with everyone. We've all been in that position. We've finally made the decision to come, and I really, honestly can't believe I can't wait to share pictures. Not the same pictures as Dr Remzi's got, but maybe a nicer picture. But it's just incredible.
Yeah. No, I mean, it is a hard process, isn't it?
Yeah, it's an extremely. I genuinely went in it with a little bit of naivety because I thought, as a woman and the woman that I am, I'm like, I can do it, no problem. I've had 3 kids by myself. I just have gas in the air. I can do this. Totally different. Totally different.
I'm just so glad, to everybody who's going to be watching this, I'm just so glad you're saying this, because I just wanted you to do it and then tell me how it is, because you're the one speaks to more people than anyone else in the team, people who's planning to come for a surgery, and yes, they've been given, yes, they'll do BBLs and breast lifts and everything all in one go. Just you can't. If you're going to do something properly, you just cannot. And because I always seen this side, you don't see this side, you don't see after surgery, you don't see the 2nd day, the 3rd day. I'm just so glad now you have. And you have experience yourself, so everything will come from an experience.
Exactly, Keir. I mean, Dr Remzi came round and done the dressings every single day with his team. I can't speak highly enough of just how amazing he is at what he does, but the whole care system, we know, because we work this is what we do, but for other people to come, it's just an incredible situation to be in.
I mean, we haven't, we really are, we're fortunate. Now the team, you met the new team members. We are here 24/7, and yes, you did, especially after the plastic surgery. Yes, you do need, bits and pieces being brought to you, and you can't get up at the same time and when you want it, and because you're not as mobile as like you were after the sleeve surgery. It
really does flow. It really does, and he did tell us the first couple of days that we had to rest and take it easy. And no working, no on our phones, just to really, which is difficult because your life is on your phone and you do everything on your phone. But we try to really do, we've obviously got to travel, we've got to get home, and we've got to do our isolation when we're home, we've got to go to Ireland to do that. But when I come back for the next set of work, Dr Remzi's already, when we chatted about it, you need to be here just a little bit longer, so I will only go home in 7 days, I will stay longer again.
I think, like we've seen with our couple of patients who stayed here for 2 weeks, we've seen the difference in people coming for 7 days and going back, and people staying for 2 weeks and coming back and getting it checked over and going back. There is definitely a difference.
Much better.
You just need to give yourself that time. Thank you so much, and thank you so much again. And let's go and enjoy the rest of our Sunday.
And we'll see Dr Remzi soon.
I say that, but I'm just going to take a ball.
You're going to work. We've gone back to the hotel to lie down for a little while. The dressing changes are a little bit sore, so go home and
thank you so much.
Thank you.
Thank you.
See you soon.
Thank you. I'll see you soon.
Yes.